attending our session. My name is Johnette Peyton, and I briefly wanted to go over the agenda with you. I will be discussing intimate partner abuse and some of the risk factors associated with that. Then I will turn the presentation over to Dr. Potter, and she will give you some case studies from some of the work that she has done. And then I will bring it back around to intervention and prevention strategies, and we will both provide you with a summary and a conclusion. And you'll also have time for questions and answers. Thank you. So to begin, I wanted to talk about some of the risk factors that are associated with intimate partner violence. And some of the health factors that victims may suffer from include having trouble sleeping, suffering from internal bleeding, depression, suicide, panic attacks, and even death. This is a quote from the National Institute of Justice, which states that violence against women in intimate relationships occurs more often, is more severe, and is more likely to be repeated in economically disadvantaged neighborhoods. And when I talk more about some of the risk factors, I'll talk about how things such as living in economically disadvantaged neighborhoods, suffering from unemployment, how all those things can be related to intimate partner violence. To begin, I wanted to give you a definition of intimate partner violence. Some of the problems with a lot of violence is that the definitions may vary. It varies depending on the setting. If you're in a healthcare setting, it may be different from if you're in a criminal justice setting. And also, there are a number of different national surveys. And again, that definition can vary depending on the survey parameters. One of the generally accepted definitions is that intimate partner violence is physical, sexual, or psychological harm by a current or former intimate partner or spouse, and it can occur among heterosexual or same-sex couples. For the purposes of this presentation, we are focusing on women as victims and men as batterers. There are men who suffer from intimate partner violence, but overwhelmingly, studies indicate that women make up about 85% of intimate partner violence victims. Just to give you some examples of the different types of violence, the first is physical violence, and that is the intentional use of physical force. And some examples of physical violence include shoving, choking, shaking, slapping, or punching. With sexual violence, there are three different categories. It can consist of physical force to compel a person to engage in a sexual act, an attempted or completed act, or an abusive sexual conduct. The next type of violence is threats of physical or sexual violence, and this includes communications with the intent to cause death or disability. Examples of this include words, gestures, or weapons. With emotional or psychological violence, this is really the perpetrator using coercive tactics against the victim, and includes threats, intimidation, humiliation, and isolation. The last is stalking, and with stalking, this is one that, especially depending on the setting or the survey definition, it may or may not be included in intimate partner violence, but this is when a person follows someone unwillingly, or they threaten the person, their property, their children, or family members. So next I wanted to discuss some of the numbers. One national survey is the National Crime Victimization Survey, and another is also the National Intimate Partner and Sexual Violence Survey. On average, 24 people per minute are victims of rape, physical violence, or stalking by an intimate partner in the United States. As you can see, men and women who suffer from this type of violence, they suffer from additional medical conditions such as having difficulty sleeping, suffering from chronic headaches. And women who experience physical violence by an intimate partner are more likely to have asthma, diabetes, and irritable bowel syndrome. As I mentioned earlier, the majority of victims are female. And also the majority of victims are younger females between the ages of 18 to 24 and 25 to 34. And single moms with children are more likely to be victims of intimate partner violence. You can see as compared to households with married adults and children, their rate of victimization is more than 10 times higher. Next, I wanted to talk about the National Violence Against Women Survey and a few National Institute of Justice funded studies. Intimate partner violence is more likely to occur when couples are under financial strain, and this is especially true. Studies indicate that African American couples suffer from higher rates of intimate partner violence as compared to their white counterparts. Financial strain may keep women in abusive relationships. So what happens is women kind of weigh the balance between the threat of violence versus the loss of financial support. And for some women, the threat of violence is less of a threat to them than the actual physical violence. Unstable employment increases the risk of intimate partner violence. Studies have indicated that among those who keep employment, they have very low rates of intimate partner violence, and the risk of intimate partner violence increases with every episode of unemployment. So if there's one episode of unemployment, it rises, and if it's two or more, it's nearly 3 times the rate for those who maintain employment. As I mentioned earlier, African Americans have a higher overall rate of intimate partner violence. This is due in part to higher levels of economic distress and more frequent residence in economically disadvantaged neighborhoods. There was a study that was done that indicated that Asian and Pacific Islander women and men report significantly lower rates of IPV. And what they suggest is that some of this has to do with cultural factors, social factors, environmental factors, and especially among Asian and Pacific Islanders, they have closer ties to family, and they favor harmony, so they may be less likely to report it. With African Americans and American Indian Alaska Natives, they report higher rates of IPV, and they found, especially among American Indian and Alaska Native couples, that they have significantly higher rates of intimate partner violence compared to their white counterparts. Hispanic women were significantly more likely to report having been raped by a current or former intimate partner in their lifetime, and this was significant because earlier studies indicated that Hispanic women were less likely to suffer from intimate partner violence. So this was really telling in this study that they actually found that their rates were as high or higher. And lastly, women living with female intimate partners experience less intimate partner violence than women living with male intimate partners. Next, if you check your handout, you have a copy of the Power and Control Wheel. This was designed by the Domestic Abuse Intervention Project, and what this does, it's a great tool for providers, and it's also a great tool for victims because it helps them kind of understand the overall pattern of abusive and violent behaviors. And these are the types of behaviors that are used by batterers to establish and maintain control over their partners. So next I wanted to talk about some of the perpetrator risk factors. And these things, they do vary, but in general they found that early fatherhood was a risk factor. So among men who'd had children before the age of 21, they were more likely to be batterers than those who had not. Being raped at a young age and having a violent past. And what this means is a batterer who in the past suffered from angry outbursts, or they got in trouble in school a lot, or exhibited violent behavior, and then experiencing violence at a young age. That's if their parents abused each other or they experienced some type of violent act when they were young. Using drugs or alcohol, this is a big one. This one is very significant. It's been found across a lot of studies to indicate that especially the use of alcohol contributes to the rates of intimate partner violence. And it's not to say that if someone is an alcoholic, they will be a batterer. And it's not to say that those who do not drink will not be batterers. And lastly, not having a job or other stressful events. Those types of things, there's a situation that could be potentially volatile, but when you add these other stressors of unemployment or financial strain, it makes the situation worse. With victim risk factors, some are very similar to men having been abused as a child. If they are in an unmarried relationship, in early parenthood, again, they found that women who had children before the age of 21 were significantly more likely to have experienced intimate partner violence than those who had not. Having a verbally abusive partner, studies have indicated that with verbal abuse, it's kind of a predecessor to the violent acts. Status disparities with partners. Studies have indicated that women who have higher education levels have a tendency to have higher rates of intimate partner violence. And alcohol abuse. This alcohol can be used as a means of control by the batterer, and it's also used as a coping mechanism for the victim. As I mentioned, suffering from severe poverty and associated stressors, and dependency on the perpetrator. And this is especially important with those living in lower income neighborhoods and some immigrants. If they are depending on their partner for their residency status, then they may be more likely to suffer the abuse. I just wanted to talk briefly about some of the similarities between alcohol abuse and physical abuse. Both involve denying that there's a problem and trying to make the problem less important than it is. Both involve isolation of the family, and both may be passed from generation to generation. So next I wanted to turn the presentation over to Dr. Parter, and she will provide you with a few case studies.
I have a few case studies, most of which will be from my work, but also from some other work that's been done for all the books I have up here. So first I want to talk a little bit more about the vulnerability of some individuals more than others. We have this idea, and this is coming from some of the theory, but a lot of this theory that's based on this intersecting multiple marginalizations actually comes from activist work that started 3-4 decades ago within the advocacy around intimate partner abuse, particularly against women. That came about particularly in the whole second wave of feminism, mainstream feminism in the United States, where they said, we need to do something about this. It's not, we can't just have police officers showing up to households and not doing something with these heterosexual couples when the male is beating the female or otherwise abusive. We need to have some type of intervention and some type of official intervention. So a lot of it came actually from the activists, and then it went into the academic realm. So all these different, we all have intersecting identities, and they vary to place, situation to situation. It's just that some of us are situated on many of these that you'll see up here at the lower end of that hierarchy, right? So in the society, in the United States, white men tend to be at the top, but particularly white men who are at least middle class and above, right? Not to say, though, that white middle class men or upper middle class men do not have some type of struggles or things that they're going through. It's just the way that our society works. Some of us, women in particular, suffer from sexism. Then there's such idea of heterosexism, where individuals who are not heterosexual, lesbian or gay, or just bisexual, anything but heterosexual, may suffer from abuse, discrimination, and the like because of that. There's also the issue of poverty, right? So we know, and we can see, going back to the statistics that Johnette went over, that individuals who are living in at lower income levels, it's not only in and of itself is that an issue that they have to deal with. There are all these other things that compound that come along with that. And some of that has to do with, let me just skip ahead here, community violence. In those low-income neighborhoods, we are going to see a lot more street or public violence. And I do want to, maybe an asterisk on this whole conversation that we're having here. We do know that intimate partner abuse can affect anybody, regardless of heterosexuality, homosexuality, regardless of income level. We know that rich people, they're rich people, right? We know that happens, right? But based on the research that, the numbers, the statistics, based on the research that has been done, and particularly the surveys, so like the National Crime Victimization Survey that Johnette went over, we do see that there are some individuals, and those individuals who have these intersecting multiple marginalizations, meaning they're marginalized because of these identities or these associations or these statuses, that they are suffering a bit more than those who are well off. And so, back to so community violence and state violence. That refers to that's kind of a more of a radical kind of a take on it, or critical. We like to use that word, which just refers to some certain individuals who do not have higher statuses, when they suffer more from, say, police officers, police brutality, right, than maybe people who do have some affluence. They may suffer more from just the way the system works, meaning, systemic, the types of things that we provide individuals, so government funds and the like, that they may suffer more from discrimination based on that. And then there's a lot of other examples for that as well. We do know the immigration status, particularly if you are non-immigrant, or sorry, if you are an immigrant, excuse me, that is also considered marginalized, particularly for individuals from Mexico and Central America, right? Anytime, because I talk to my students about this all the time up at CU, I ask them, so what comes to mind, what's the image that you have when you hear the word immigration, right? And then I force them to tell me, what is that image, right? And so it's Mexican, right? And we know that there are plenty other immigrants in this country, and that most of us have some type of immigrant background in our history somewhere along the way. Most of us do. But we do know that for those who are immigrating from Mexico, Central America, that they're suffering even more than maybe some other immigrants, particularly immigrants from Europe or Russia or that particular area. There's also the issue of employment and housing discrimination that individuals face, right? So you're already living at these low income levels, and then you're trying to get some assistance so that you can get a leg up, right? So that you can try to reach that so-called American dream. But along the way, because of all these other intersecting issues, which I'll bring up the other ones like racism and sexism and the like, you may face discrimination as a result of that. And then, of course, racism, that one probably goes without saying, that many individuals suffer from racism. And then colorism, for those of you, if you're not sure on what that particular term means, that's within a racial group, where you will have individuals discriminating against others. So a lot of this, I've been doing this for several years, but it's still kind of hard to share some of this when it's a mixed race group. But within the African American or Black community, oftentimes for those who are fairer, so closer, skin tone closer to white, or even some features closer to white, oftentimes they're put at the higher end, at the top of the hierarchy within that. And then there's discrimination within the group against darker-skinned African Americans. And then even sort of within the group but outside the group, there's been some studies that you look at who's in prison, and they show that they did those particular studies, that those individuals who are in prison or even who's getting arrested are the darker-skinned African Americans or darker-skinned Latinos and Latinas, right? And so that's how kind of colorism works as well, even with outside of a particular group. And so we have to think about all these things when we are thinking about assisting others, that they are facing these multiple marginalizations, and that when working with them too, that you kind of check yourself on these things, and that making sure that that you don't have these preconceived notions about what's going on with them. And that's where it becomes very important to listen to the stories of the individuals. So the type of research that I do a little bit of stuff, as long as it's with other people, and I call it stuff. That's statistical research, the quantitative analyses and things like that. But my favorite research and the type that I specialize in is qualitative research. And that's where I go out in the community and I just talk to folks. And so then I also use it as an excuse when I'm hanging out at a coffee shop and just not doing my work and just like looking around. I'm working. I'm observing society and seeing what's going on here. So that's the type of work that I do. When I worked on my doctorate, 10 years ago, I kind of fell into doing work on intimate partner abuse. I originally was going to do something with women in prison, but I couldn't get into prison. And so it just kind of picked up this project. And folks were not sure, meaning my mentors, weren't sure if I was going to be able to get my sample, meaning that, I wanted to interview 40 women who identified as women, identified as African American or Black women, and women, so adults, who had been or were currently in abusive relationships. And I was doing it locally. And so people were like, are you going to be able to find enough? Oh, there's only so many Black people here in the Denver metro area in Colorado. And I was convinced that I could. I mean, just talking to my mom, two of her best friends, and then a couple other people. So when I started talking to her about this project, she's like, oh yeah, so-and-so and so-and-so. And I was going to interview them, but then it was a little too close. So I put an ad in a paper. It's a monthly publication here in Denver, for those of you who aren't from here, called the Urban Spectrum. And the readership is mainly African American. And that's all I had to do. I did that for a few months. I planned on doing all these other things, reaching out to different organizations, and including the criminal justice system and the police departments and things like that. But I just put this ad in the paper, and people saw that. Some people who were friends of women who fit within that criteria said, hey, look at this, that with your husband, maybe you should call her and talk to her, call the research, talk to her about that. And then some of those folks that I got in the study were friends of, and then we call that snowball sampling. And so I had, in my particular study for that, which is from my book, which I'll talk about today, so it started out as my dissertation and became a book later, there were 4 mother-daughter sets, meaning that I went and I interviewed 3 of the women. When I talked to them, I would ask them. So I was getting their life histories. So it's not, again, it goes back to that previous slide. It's not just about the abuse. What else is going on in these women's lives? So when talking to them about their situations, their lives, they would talk about their mothers, their grandmothers, their aunties, their sisters, their daughters, if they were a little bit older, going through this. And so 3 of the women were about middle age, and they talked about their daughters. And I said, well, so maybe, do you think you could ask your daughter if she'd be willing to talk to me? And so that's, so I would end up going back to the house or going to wherever the daughter lived and interviewed them. And then one of them, I interviewed her mother. She was a woman in her 20s, and so I interviewed her. Since then, I've continued in this particular work, and starting with that study because of the higher proportion of interracial relationships in the western part of the United States, and particularly here in the Denver area. There were some of the women who had been abused by men who were not Black, and these were all heterosexual women. Even though I didn't particularly seek that out, that's just how it happened. So there were a few women in that study, 4 of the 40, who had also been abused by men who were not Black. And so I wanted to, and there's nothing pathological or strange going on with that when that happens, because I had to point that out as well. And the same with with the rates being higher amongst people of color for intimate partner abuse. There's nothing strange. It's just all those other factors that Johnette talked about, and that I showed on the previous slide. That's what's going on. And particularly as a sociologist, I really push that if there's not some kind of biological issue that's going on. And so I've since done another study on interracial, intimate partner abuse amongst interracial couples. And that was where I interviewed women who'd been abused by a partner who was not of the same race. And then there was one guy who called. He is a gay white male, and he called just because he said, "Well, I know I don't fit your study, but I was abused by my Black boyfriend." And so we interviewed him for that. And so hopefully at some point I'll write a separate paper on that. And last year I started. It's still in the sort of piloting phase, a project where I started to interview, and there are a couple other studies in there as well, but these are the bigger ones. Started to interview men who use violence, because I wanted to compare men across race, across all those other or those other demographic areas, and the different types of targets of their violence, right? And so me and my research assistant about a year ago interviewed about 40 men. And I don't have any quotes from them today, but I can give you just a bit about that if you'd like to hear more about that during the question and answer. And it was kind of, so about of the 40 men, about almost half were men who I called fighters because they fought, with their friends in bars and things like that, but they did not engage in abusive or violent behaviors with their intimate partners. And these are all, for this study, I specifically asked for heterosexual men, just because there are some different things going on in there. And I'd like to in the future talk to gay men and do that same study, or similar study. And then the other almost half of men, I call them all around because they just, they were just violent towards everybody. So they're intimate partners, they're just fighting in the neighborhood, everywhere. And then there were only 2 men who identified as just batterers. And so that's kind of an interesting piece where the only types of violence they used was, private, against their intimate partners. And so that was kind of an interesting take. So I'd like to read, that's the wrong thing here. I'd like to read a little bit first from my book. And I'll try to keep my reading short. The first couple things I'm going to read are just based on case notes. And one is from my work and then some from another scholar's work, which I'll mention her in a second. And then in the next slide, I'll go over some of the women's quotes, things that they actually said. So Billy is a 42-year-old woman who has remained in the same western U.S. city, Denver, obviously, and lived in low-income status her entire life. Although she has completed some formal vocational training, she left high school in her final year and throughout her life has maintained sporadic employment. Billy experienced abuse from a number of family members during her upbringing, including her mother, a brother, an aunt, and her grandmother. During adulthood, she has encountered 4 abusive heterosexual intimate relationships, including that with her current common-law husband, Odell, whose main form of abuse is mental and verbal. Billy began abusing alcohol and other drugs in her 20s, and though she was able to overcome her addiction to crack cocaine, she continues to struggle with her abuse of alcohol. In fact, a day after I set my interview appointment with Billy and a week prior to the actual interview, she telephoned me in great despair and in desperate need of assistance. She phoned while at her home, where she said Odell and her teenage son were verbally abusing her. I could hear the men yelling at Billy, and her son eventually picked up the phone to inform me that everything's all right. She's okay. After the phone was handed back to Billy, I found it difficult to understand her, as she slurred many of her words, making incomprehensible statements. I surmised that she was likely under the influence of alcohol and other drugs, but, and more important at that moment, I determined that there was indeed some form of significant discord occurring in the home and against Billy. I asked Billy if she felt her physical well-being was in imminent danger, and she contended that it was not, but that I was the only person she knew to call. This declaration by Billy supports other research on Black women that has suggested that they are unaware of or do not feel comfortable in seeking assistance from professionally established sources of support. It was both poignant and revealing that I, a researcher, to whom Billy had spoken on the phone on only one occasion, was her resource for dealing with her victimization. So I confirmed the happenings in the home at that time with Billy's adult daughter, Nia, to whom I had spoken the day before when Billy called to set an appointment to participate in the study. After Billy again returned to the phone to speak with me, she insisted that she needed to talk to someone. Although it was well beyond the scope of my research, and it was definitely not approved by the university, to conduct any form of counseling with the women interviewed, I made the decision to simply conduct my interview with Billy that day and to provide her with referrals to social service agencies. Billy and I agreed to have Nia drive her to a convenience store near their home where I would meet them. However, the two did not show, and I was subsequently unable to reach Billy by phone for several days. I had no last name for Billy at the time, no complete address, and only a wireless phone number, so I was unable to even contact police to conduct a welfare check on the home, and could only hope that nothing grave resulted from the verbal altercation. Fortunately, the day before Billy's originally scheduled interview with me, she contacted me to confirm the appointment. I verified that Billy was safe, but she did not offer any explanation for the incident or for why she did not meet me at the convenience store, at least on the phone she didn't. Only once did we meet did I learn of Billy's extensive history of drug use and her continued struggles with alcohol addiction. Essentially, even though family and intimate partner abuse were undoubtedly occurring when she called me the week before, Billy had been heavily intoxicated with alcohol. She did not wish for me to provide her with any social services resources to assist her, with the familial abuse or her alcohol and drug addiction. Billy expressed that she was proud that she had not drunk since the day of her frantic call to me a week before, and we both wished out loud for her continued strength in combating both her alcohol abuse and the emotional abuse sometimes carried out by Odell and her son. To judge from my time with Billy, perhaps her admonition that she needed to talk to someone can be considered in a symbolic sense. She needed to tell her story to someone who would pass it on to others, with the hope that transgressions against Black women and the life chances they have been afforded will be placed at the forefront of issues throughout the Black community. And so that's specifically, again, for African Americans within our history, because one, the whole airing the dirty laundry, sweeping these things that happen within our community against each other, that so that we don't look even worse, right? So that we're not stereotyped even more. Then it becomes, the broader issue becomes, we need to focus on things that in society generally that are happening to us as a community, right, or as a group of individuals. And so some of those things they get pushed to the side if they're dealt with at all. Even though, again, this is specifically for African American women or Black women and individuals, it does. We do see similar instances or similar stories, situations with other groups of color, with other women of color. I'm going to read a little bit from this book called Violence Against Latina Immigrants. This is also as my book. The subtitle is Citizenship, Inequality, and Community by Roberta Villolón. And she's talking here about a woman named Ana. Ana, an immigrant from Mexico, looking for better opportunities for her and her family, had married Pedro, also an undocumented Mexican immigrant in Texas. Ana had been enjoying her marriage for only 2 weeks when Pedro began to be abusive toward her. Pedro cheated on Ana, and when she expressed her wishes to divorce him, he held her hostage and hit, threatened, and raped her repeatedly. He lied to Ana and convinced her that she could not do anything about his behavior because she did not have documents. He told her that if she called the police, both of them would be deported, vowing that if they were sent back to Mexico, he would brutally punish her there. Ana had been isolated from her family and friends, and she was in panic. At first, Pedro forbade Ana to work. Later, he forced her to work and kept her salary. Ana tried to end the relationship several times, but Pedro never let her go. She became pregnant with Pedro's child from forced intercourse, but he accused her of cheating and did not believe the baby was his. His family convinced him to take care of the baby, but he did so very poorly. And quote, Pedro would hit me, pull my hair, undress me forcefully, and accuse me of being with other men. The baby would not stop crying. He would ignore him and let him cry and cry. A year later, Ana got pregnant again against her will. She explained, he used to hide my pills, and I ended up pregnant once again. He was not a good father. He was impatient and mistreated the kids. However, all he wanted me for was to have many kids, so I would stay home all the time. During the pregnancy, he continued with his usual behavior: lies, screams, arguments, fights, alcohol. And then it goes on to talk about later she was able to leave him, and which, by the way, research shows that it takes an average of 7 times for a woman to permanently leave an abusive relationship. And she talks about how he stalked her at work, he wanted to find out where I was living, etc. This is one of the stories in the book that ended much better than many of these others for immigrant women in the United States. Ana called her lawyer, who put her in touch with a local shelter for battered women that also provided counseling. The psychologist at the shelter suggested that she call the police. Then she made a report, which led her to find out about her immigration options. A lot harder to read from someone else's work. So she made a report, which led her to find about her immigration options. She got in touch with the organization that this researcher was working with. It was a refugee organization, and began to work on her U visa. And for those of you who don't know, the U visa is a visa that you can obtain if you're an immigrant and you're in an abusive relationship. And it's for a period of 4 years, kind of puts you over to the side, and the United States won't try to deport you. And it's kind of seen as like a refugee status in a different situation. So where you're here in the United States illegally, but you are in an abusive relationship, typically with another undocumented immigrant. but you have that option of trying to get a U visa to stay in the United States. And again, kind of like a refugee status for women who have been in abusive, immigrant women who've been in abusive relationships. So they began to work on her U visa. Her successful cooperation with the police provided her with certification to request protection under the VTVPA, which is the trafficking. Hold on one second. I have to look at my notes here. Victims of Trafficking and Violence Protection Act. You know, we use a lot of acronyms, right? So for protecting trafficking victims and victims of violence, that particular act. And so after 2 years, so the thing with that is, as it mentions, she had to get certification, so she had to go to the police, which is already hard because there are always those other issues, like in the beginning of this particular story, where he was threatening her with that. And a lot of undocumented immigrants don't know their rights around that, and that's why it's even worse in some situations. It's hard to do because it's like comparing apples and oranges, but because they don't have that option of really calling the police. I mean, they have the option, but they're afraid to because they are afraid that they'll end up getting deported, even though they're trying to report abuse against them. So after 2 years, Anna was granted a U visa interim relief for 3 years. She renewed her employment authorization on a yearly basis, and once U visa regulations were released, she applied for the visa. And then, so again, it goes on to, this is a much better ending than many of the other stories that she hasn't had. What's that? Okay, all right. Just have a little bit more here. So the outcomes of intimate partner abuse or intimate partner violence are many, which we know, and Johnette covered a lot of these particular issues. But what I'd like to do is read a couple of the quotes, again, specifically from the women's voices. And it's really important that we listen to the women or the men or whomever we're dealing with and take them as the experts for what they are going through. That's really important, and that's really important for qualitative research, for the type of research that I do, feminist research, to listen to the voices. So with regard to substance abuse, Billy, again, and by the way, Billy, she's featured in my book. When she was very loquacious, and our interview lasted about 4 hours, and so in one sitting, because she had a lot to say and a lot to tell me. So she's highly featured in my book here. So Billy, regarding substance abuse, it seemed like I was smoking even worse then, smoking crack. I decided I'll just stay by myself, just me and the kids. Then I lost my Section 8. I didn't pay the rent. Then I started sleeping with the dope man. I would let him come over and sell his dope and cook his dope in my house as long as he's paid my rent and my phone bill and stuff like that. What I forgot to ask is, what about food? Because we never hardly had food. I was like a vampire. I'd stay up all night and I'd sleep all day. I would sell my food stamps. So that's just a snapshot of what Billy has gone through in all her years. And by the way, my hope is this summer is to try to contact some of these women, because it's been 10 years since I interviewed them, and see if I can get an update on how they're doing. And because of the whole degrees of separation within a particular area, some of these women, a couple of them I knew. They didn't realize that, because I didn't have my name in the ad when I was advertising, and they didn't realize, that it was me. They just called the number and like, oh. And a couple of them decided not to interview with me, but some of them I knew, and some of them I knew like by 1 degree of separation in one day. And some of it I wouldn't reveal to them, but when they're telling me their life stories, they're telling me the folks, because I would tell them use names, and the like. And in my head, I'm like, oh, I know that person, So a lot of these folks I knew or knew of them personally, and because I grew up here as well, and many of them, not all of them grew up here, and some were new to this area. When they're telling me their stories about certain neighborhoods and things like that, I was able to understand what they're talking about. So with regard to poor physical health, obviously that is an issue. So for all of the women that I interviewed for this particular study, they all did endure physical violence by their intimate partner. More than half of them, I'm trying to remember, 75% of them actually, had at least 2 violent relationships. And there were a couple, there's one woman who had 5 violent relationships. So multiple violent relationships. Again, we can't pathologize that. That's a study that with a colleague up in Detroit we're hoping to do soon, is to see what's going on with that. We have some ideas, we have some theories around that. But why is it that, and one of the things that Johnette was sort of getting with some of the research, okay, with some of the research was that those who had childhood traumas, so were abused, raped, something like that as a child, have a greater chance of ending up in these abusive relationships when they're older. Again, we have some indication. There's different theories around that, but that's something I want to look at a little bit more. So with physical health, obviously, there's going to be some physical trauma that endures, that lingers after the abuse. Grace is a 43, at the time I interviewed her, 43-year-old woman. And she stated, "I was going through a medical thing. The doctor said it was stress-induced. My blood pressure would shoot up. Then I didn't have a period for about 8 weeks. I was physically and mentally worn out. I couldn't see a way out of this. I was blacking out for no reason. I had these episodes where I just passed out, blanked out. I didn't know what it was. They thought I was having a heart attack. They said it was stress. All this was going on at once." So there's not only that, physical abuse, which I have this awful story that I relay in my book about the physical, being flipped over couches and, things like that. Things thrown at them, just the awful physical abuse that the men, their partners, were inflicting on them. But then there are just the other physical health issues that result either directly from that physical abuse or because of the strain and stress that we see. So like IPV you mentioned, and some of the other things, higher rates of diabetes, etc. And then mental health, of course, is an issue. Paula, it was 41 at the time I interviewed her. "I felt defeated. Now I'm starting to feel the after effects. It wasn't so much the physical of what happened. I'm a strong individual. It's kind of like this mental erosion, trying to support myself mentally and emotionally with no family. But life still goes on. The everyday stuff still goes on. And nobody's seeing after me. You know what I mean?" So just no assistance there. And again, I talk more in my writings just about these women being left out there on their own, particularly the issue of the strong black woman and you need to handle this or you need to go prey on it and the abuse will stop and all these other types of things. So these are some of the outcomes, and I have one more quote here from Cicely, of the abuse. Most of the women who I spoke with, or all of them, at some point fought back. Physically fought back. None of the women, of the 40 women, the first abusive relationship, the first physical hit back or did any type of physical retaliation. They were able, because you're able to recall. After that, it gets a little fuzzy with some of it when they were trying to recall like the different violent episodes, the different nasty things he said, particularly the longer the relationship, and for the older women, they're covering a large span of time. But they all remembered that first abusive or that first violent incident. And the same thing, it was harder for them to remember that first mental or verbal or psychological abuse. It was hard to really detect when that really started happening. But they remembered that first violent incident and that first abusive relationship. For most of them, by that second hit, they were physically retaliating in some way. And there is research to show that African American women in particular, and this is some quantitative statistical research, that African American women physically fight back more than other women. And the way I theorize that is that, again, that idea that black women were expected to, handle everything and deal with it on our own. We're expected to, we have this identity of the strong black woman, et cetera. So there's a lot more that goes into that. So just want to close it out with Cicely. Cicely told of how she began to feel with her first abusive relationship, which was her second marriage, which lasted about 5 years, and then of her actions towards her third abuser, which was her fifth husband, who was hard to keep track of, to whom she was married for 7 years. When I had gotten to the point where I wanted to get out of my second marriage, I would lay there in bed trying to figure out how I could kill him. without me going to jail. Could never come up with a lot of it. I could never come up with a good reason in how I can do this. And that's why I never killed him. One of them I did try, though. He would come in and he would want to have sex, and I didn't want to be bothered. He would force himself, and it would hurt. Twice he choked me to where I passed out. I would leave, and I would go back. I would keep a gun up under the mattress. But I ended up in the hospital. But not because of his hitting me or with his verbal abuse or taking the car and selling it to drug dealers, et cetera, et cetera. I got so angry that I couldn't kill him that I tried to commit suicide. They had to put me in the hospital for being homicidal and suicidal. I was trying to kill him, but I couldn't find him. I was going to kill him, shoot him, trying to find him, and I couldn't find him. So I ended up in the hospital because I was so angry that I was going to take it out on myself. I called the suicide hotline. And I didn't call them to respond, for them to respond to her. I called them to talk me down so I could calm down so I wouldn't react. And so I'll leave it at that. And if you have questions about any of this when we get to the question-answer session or about any of my research or anything else that we cover, I'm definitely welcome to answer those. Thank you.
So next, I just briefly wanted to talk about intervention and prevention. And one of the really important points that Dr. Potter brought up is that a lot of times, many of us probably know women who have suffered from this. A lot of times, the victims feel like they're alone and they don't have anyone to turn to. So it's really kind of important that we have programs in place to assist these individuals. So just really briefly, I wanted to talk about the cost of intimate partner violence to society. Because women touch the system in so many different places, they may go to the emergency room, they may visit their primary care physician, they could be referred to mental health workers, and they also may have to attend substance abuse programs. So the cost associated with this adds up exponentially. And also there are the days of lost productivity, women being unable to work, not allowed to work. These all the costs add up. And again, a first bullet does not include the costs associated with the criminal justice system. So as you can imagine, this is an underestimation of the total cost. Next, I wanted to talk about Healthy People 2020. They do recognize that injury and violence prevention is a very important topic, and they recognize that injuries are the leading cause of death for Americans ages 1 to 44. These are just some of the objectives that they have. Because the objectives are in the developmental stage, they do not have specific decreases associated with them. So as providers, some of the goals of intimate partner violence treatment. The immediate goal is to ensure the safety of the individual. One of the most dangerous times is when the victim decides that she's going to leave the batterer. So if there is an intervention in place, we need to make sure that she and the safety of her children are accounted for if she has children. We also want to make sure that there's a safety plan in place. And what a safety plan is, that's basically they go through a list of questions and they think about if they leave this person, what will happen. They have a list of safe places that they can go to. They have a list of safe people that they can talk to. They also make sure they have money in their pocket. They also have to think about what happens if the victim is confronted by the batterer. What will they say? How will they make sure they control the situation? And they also have to make sure they have a change of clothes. These are basic things that we may take for granted, but for someone in a volatile situation, it's very important. Next, as providers, it's very important to ensure that there is the appropriate medical help and that any evidence is preserved in case there is a possibility of a legal case. It's important to understand the resources in the community, things such as hotlines, crisis centers, or emergency rooms. So next I wanted to talk briefly about some of the screening tips that are recommended for providers. One quote is that a woman who comes to the emergency room at least 3 times with injuries has an 80% chance of being a battered woman whether or not the injury requires stitches. So as you can see, and this is pretty pervasive through a lot of the recommendations for healthcare providers, is that women should be routinely screened, women of childbearing age. This is whether or not you think they may be suffering from intimate partner violence. It's better to just go ahead and screen everyone. It's important that whomever does the screening is trained in how to approach these victims of, or these potential victims of intimate partner abuse. They have to make sure they approach the person in a safe way. They don't say anything that's accusatory. They let them understand that it's okay for them to ask for help. And they also have to be culturally competent. Next, the screening should be part of the regular face-to-face encounter. Again, this makes sure that you screen everyone and you're not being selective and you potentially miss people. It should be part of a routine health exam, and the screenings can occur in any medical environment, such as primary care, urgent care, and mental health. So I wanted to just briefly talk about the recommendations of the U.S. Preventive Services Task Force. And this has a B recommendation, and they found adequate evidence that interventions can reduce violence, abuse, and physical or mental harm for women of reproductive age. The American Medical Association, they support routine assessments, so they feel that everyone should be assessed for any physical or mental signs of intimate partner abuse. They also recommend that all physicians are trained on violence prevention. This is very important, again, as I mentioned, using things such as the FRAME network, where you make sure you talk to the person, you approach them in the right way, because you can start to talk to them where someone could potentially be receptive, but something you may say, a tone, or a way you may look at a person could turn them off, and they will decide that they do not want to receive help. They also want providers to work collectively to provide leadership. So they should work with other healthcare workers, mental health providers, the criminal justice network, and assure patients that the information shared will be held in confidence. This is important because you want to make sure the person is safe, but you also have to make sure if the state that you're in has mandatory reporting requirements, you do abide by that. And the Institute of Medicine, again, their recommendations are along the lines with everyone else, where they recommend that all women of childbearing age are screened for domestic violence. So a few examples of some of the screening tools. The first one is hurt, insult, threaten, or scream, also known as HITS. It's available in English and Spanish versions, and this one is an instrument that's only 4 questions. And it can be administered by either the clinician or the person themselves. The humiliation, afraid, rape, and kick, that is a 4-item instrument. So a few suggestions on how to prevent intimate partner violence. You can work from the social level, where you're working with legislation, or down to the community level. You make sure you have resources available in the community. And relationship levels. This is very important because having a support network, as Dr. Potter mentioned, a lot of times women don't feel like there's anyone that they can talk to, or they are embarrassed about what they're going through. So it's very helpful if they have peer-to-peer people that can talk to, that help them to understand that this isn't something that is their fault and that they can get help. And then individual level, that helps to bolster their confidence, because as you experience this, you lose your self-confidence, you lose your self-worth, and you don't feel that you are even worthy. Again, some examples of intimate partner violence interventions include counseling, and they can be counseled on safe behaviors and community resources, home visits, offering emotional support, ways to solve problems, and parenting support. Information cards that give them problem-solving strategies, and referral to community service. So this is just a list of some of the elements of effective intimate partner violence interventions. For example, outreach. you want to make sure you understand your audience. Sometimes people want to participate in things, but they don't have transportation. They don't have childcare. So if you make sure you make these things accessible and easily available, then you will increase your reach. Interdisciplinary approaches, examples could include cross-training of physicians by mental health workers on, and also police officers on ways to identify intimate partner violence. And as clinicians, some of the things that are important to remember are having indicators, if this is in your EHR system, or ways to flag it, having checklists to make sure that all staff or that every patient is checked for intimate partner violence, having resources, making sure that the resources that are available are in places that could be in private, so that if the woman comes with the batterer, he doesn't see her take this pamphlet. You can have a pamphlet in the exam room, you can have pamphlets available in the bathroom. Thinking about things like that is really important, and making sure that the staff is trained on these issues and that they're culturally competent. Other examples include engaging the victims and volunteering that helps them with their social support, knowing that they have people to turn to, arts, other cultural activities, peer support, and faith-based activities. And lastly, again, the importance of multidisciplinary groups. These is very important for everyone to work together, the healthcare professionals, law enforcement, researchers, the faith, spiritual leaders. This helps to not only expand the community resources, and it helps to get things such as legislation. It also helps if one segment, such as law enforcement, sees an issue, and maybe the mental health person can shed light on it. So it's important for them to all work together. So lastly, the conclusion is that intimate partner violence may be difficult to identify because it's a pattern of abuse. The statistics are staggering. Abuse of a woman occurs every 15 seconds in the United States. And nearly 30% of all female homicide victims are killed by their husbands, ex-husbands, boyfriends, or partners. Mental health and substance abuse are potential factors. It's a factor for both the victim as well as the perpetrator. And social support systems are very important. And screening will help to identify risk and reduce or stop intimate partner violence. Is there anything else you would like to say in closing? Okay. And then I just provide a list of resources for either providers or for your patients. Any questions? Thank you. Yes. The HITS one is very popular, and I actually would have shown a screenshot of it, but it's subject to copyright, so I didn't. Yeah. But yeah, that one is really short. It's only 4 questions, and because either the provider can fill it out or the patient themselves, that makes that one very easy. Hurt, insult, threat, and yeah. It might be faster to use the. Mm-hmm. You can use that as a tool, but also one of the things that they suggest is, because you can find a lot out just from conversation, and that's why using something such as framing to make sure that when you talk to the person, you say, it's not, you don't think that that person particularly is suffering from it, but you just say, because I know a lot of women may suffer from intimate partner violence, I just want to. So that way you make it more general and they don't feel that, oh, she suspects something. Yes. Well, studies have indicated that, yes, that does happen, but do you want to respond to that?
With regard to the women who hit men, because as I mentioned in my study, the majority of them were fighting back. There's a difference typically, not that there aren't some men out there in heterosexual relationships. Not that there aren't some men in heterosexual relationships who are being abused violently or physically or something like that. But what is the fear factor? And oftentimes when you look at the research, when you look at the research that's been done on that, men say, oh, they see it as, as like it was funny. I wasn't really fearful of my life. I knew I could handle myself, and I knew I could, come back at her or put her in control if I needed to. So for men, it's more so, it's less of the physical, but if there is the abuse, it's more so, tends to be more so the mental and psychological abuse from their female partner. What's that? Which is still, I mean, if you look at a lot of different things that are written, whether it's academic or it's more the popular stuff that's written, or just interviews you see on talk shows and things like that, most women will say that mental abuse, that psychological abuse, verbal abuse is worse than that physical abuse. Yeah, that physical abuse scares the heck out of them right in the moment, but it's that, a lot of women I talk to, they talk about, I can still hear that nasty stuff that he's telling me. I'm still trying to get through that. My injuries have healed. And again, there may be some physical health as a result of that, but as I mentioned in that one quote, with that stress that was coming from, it was coming more from the mental anguish that she was suffering from as a result of the abuse generally. So yes, women are hitting men, and that's the other thing when with our newer laws that were enacted starting 20 years ago or something like that, with the mandatory arrest or the dual arrest and things like that, we did see more women being arrested. But that same thing, if you go into those better intervention groups for women, most of them, if not all of them, are, you'll be able to identify at some point that they were really the victims. They were not the aggressors. What's happening is that oftentimes we talk about heterosexual couples, the female partner is not as physically strong as the male partner, right? That's the biology I'll agree with, being a sociologist, right? And so what's going to happen, oftentimes, he can use his body to hurt her. But when she's trying to protect herself, sometimes picking up the proverbial frying pan, because I even had a woman say that, I picked up the frying pan and I hit him, or I picked up a knife, or like the woman I read, I kept a gun, and a couple other women, I would keep a knife, stuck down in the couch. They're picking up these things because that's what they're using. So what's going to happen when you're throwing frying pans or irons or things like that at someone? It's probably going to cause a little bit more injury than what can be seen by some of the things that their men are doing. Not that you can't see choke marks or things like that, but so when the police show up to the home, whoever calls, whether it's someone in the couple or a neighbor or something like that, they have to determine who was the aggressor in this situation. And oftentimes the evidence they're going off of is who looks most injured. But you have to remember that story that I just told, that male might look more injured because the woman had to use objects to protect herself. So based on the research, anecdotal stories, things. Sorry. Okay. Okay, there we go. Things in the popular press. Men are not as fearful in these relationships. And yes, there are some men, but most men are not as good. There's not that fear.
I just wanted to read something really quick that was given to me that's related to this topic. It says, I got flowers today. It wasn't my birthday or any other special day. We had our first argument last night. He said a lot of cruel things that really hurt me. I know he is sorry, and I didn't mean the things he said because he sent me flowers today. I got flowers today. It wasn't our anniversary or any other special day. Last night, he threw me into the wall and started to choke me. It seemed like a nightmare. I couldn't believe it was real. I woke up this morning sore and bruised all over. I know he must be sorry because he sent me flowers today. I got flowers today, and it wasn't Mother's Day or any other special day. Last night, he beat me up again, and it was much worse than all other times. If I leave him, what will I do? How will I take care of my kids? What about money? I'm afraid of him and scared to leave. But I know he must be sorry because he sent me flowers today. I got flowers today. Today was a very special day. It was the day of my funeral.
Um, from my understanding is that it does help because they see, particularly with the women who I interviewed, they all were able to leave. They all left the relationship. There were 3 women who, at the time I was interviewing them, they were currently in a relationship they thought was going to be, it was kind of moving into an abusive situation. So from my understanding, just talking to, when I give talks, community talks and things like that, it does help the women to see that other women have gotten through it and that other women are experiencing the same things that they have, and then there's that ambivalence and the going back and forth, and we have to remember that typically in these relationships there was love at some point, and so you're dealing with that, those emotions on top of that. So from my understanding, it does help to see other stories, and for the women who I even interviewed, the process of the interview and talking through it, there were several, many, I don't have the numbers, I think I have them somewhere, but who said that this is the first time with you that I've actually told my story. Because I was just this researcher, right? I wasn't an authority figure, and that's an issue that we have to figure out how to deal with that. I wasn't a family member, so I wasn't too close to them. And then for them being black women, a lot of them would talk, some of them thought I was white until we saw each other when we met up at the wherever the interview was taking place. And then they saw me and they either mentioned it initially or at the end, like, well, I was glad to see that you were black. It's nice to share this. And then some of the older women even would talk to me like in a motherly way, like, make sure that you don't get, because they thought I was younger than I was, make sure that you don't get into this situation, when you go into relationships. So it does help to produce stories like this, and particularly successful stories, even if there was a lot of trauma along the way. Successful meaning that they were able to get out of the relationship and to see that other women have gone through that. And that's why we're trying to do more research too on outside of, so for Native American women and for Latino women and Asian women as well. Yeah, I actually have printouts here it's the battle cry.
There are, and actually in the resources that I provide, the CDC has training and they have suggestions specifically for providers, and it is in the resources section of my presentation. And all of these presentations will be uploaded to our website. So I think it's on this. I will locate it. It's on my slide somewhere. And I'll let you know what that is called. But the CDC definitely has resources for that.
Yeah, definitely. Are you here local? Are you? Yeah, there are a lot of resources for that, so maybe we can talk afterwards. A lot of the coalitions, the Colorado State one, and then locally for Denver, or for the city for this particular area. And that's one of the issues, is that a lot of women, particularly women of color, particularly immigrant women, they don't know of the resources, or that a lot of times they think. Because some of the women who I spoke with, they would say, well, I didn't go to a shelter for different reasons, right? But one, I thought that was something for white women, you know. I thought, you know, that would show that I'm weak. I didn't want to be separated from my family because of the, you know, some of them knew of because of the different constraints that they have. You know, for one, you know, it has to be, shelters have to be protected, and so no one can know where they are, and then they have a lot of different rules around that. Some of them even going to them, just some things. They've worked tremendously on this in the past years, but just for so for Black women, having Black hair care products, you know, having a comb that can get through our hair, things like, you know, just even little, you know, basic things like that. They have improved on that, but just a lot of different reasons why women, you know, one is that not even knowing what's available to them and how difficult it is to go to your family and talk about that, and how these relationships do affect your relations with just anybody and wanting to get out of the house and talk to people. So there are resources out there. Right. No, yeah. Yeah, definitely. And that's what lately my shift has been into that. And anytime I get the opportunity, so a couple times um, up at University of Colorado Boulder, where we were able to go in and speak to the football team, which that's about 100, because particularly after there were some issues a few years ago with that, and talking directly to them and educating them, using the same stuff and educating them, making sure that they get, you know, wherever we can, that we get at them, changing the language around it. So as opposed to she got beat up, that he beat her up, right? When we're talking about like public announcements and things like that. Why does she stay? Why doesn't he stop abusing her? You know, so it's switching it over to that. And so, yeah, so I'm totally with you on that. And that's why I also moved into that other research project where I'm talking to the men who are abusive. Not that we don't need to continue to talk to women who are in these situations, but to move into talking to the men who are doing this to figure out what's going on with them. And the thing about it is that, as Johnette mentioned in some of the research, the histories are similar. It's just that the men, the boys are growing up to be men who are using violence, and the girls are growing up to be women who are being abused. So, but their histories are, when you look at their histories, they're very similar. Seeing a lot of violence, whether it's inside the home or outside, or being victims of violence themselves. So, we definitely do need to bring them. We can't do it without the men. They're half the population. So, and when we talk about who are mainly the perpetrators with intimate partner abuse, I think you had a question or comment. Yeah. But what kind of love? Oh, crazy love.
Well, that's a pattern of intimate partner abuse. They start out in this honeymoon phase and everything is great, and then there's a tension building where you know something is coming, and then that's when they have the violence or emotionally abusive things. Then they're back to the honeymoon phase, and it just continues.
Yeah, it's not healthy love, that's for sure. But as I mentioned, there's definitely some love going on, and then there's all those ideas that like, no, it's not, the relationship won't continue to be this way. I can fix him, right? It's important for me to work this out because I really do care for him. Just all these different things that are going, and then there's also issues of being trapped in that relationship for some women. Emotional entrapment. There's yeah. It's hard to understand, but there is that emotional entrapment. That yeah. Right. Mm-hmm. Right. And it's very similar. We hear the stories. There was the recent one. Was it in Ohio? No. With the 3 women were rescued.
Mm-hmm.
That
was a lot. That was Ohio.
Right, but we need to think about those stories and use that as an analogy with intimate partner abuse, right? There were some things that have been coming out that said it seemed like there were a few times where maybe those women could have escaped, and we hear that with other stories when we hear about those types of kidnappings and things like that. Very similar situation where an abuser is using those same tactics that these, whatever we call these monsters, we call these other men. Ariel, whatever his name is, we call him a monster because of what he did, but it's very similar to what abusers are doing on an everyday basis, to using these techniques to trap them emotionally. What's that? A woman said,
they call police. They'll call the police.
Sometimes it gets a little worse
if
a woman threatens that.
Mm-hmm.
It just depends on the situation. For some men, they'll say, no, you won't, and hits are even harder. Depends on the man, depends on the situation. Depends on the tactics that are being used.
Mm-hmm.
And so it's definitely, it's very complex. It is hard for individuals to understand, and that's why, like I said, I think we need to start comparing it to these other situations where it's easier, so like these kidnappings, these abductions, that's what they're referred to, right? These abductions we hear too, it's very similar. I'm trying to think of some of the different terms they use, but like the syndrome, Stockholm syndrome, right? That's pretty much what is going on in these relationships. They're being trapped in these relationships emotionally, psychologically. And I know it's hard to understand, but that's how we have to look at that. There are just so many different things, other things that are going on. And then a lot of people too. There's the financial, entrapment. Like, once I get myself together, I can get out of this relationship. And we know that, because you mentioned this, right? That there's a greater chance of a woman being killed once she leaves. That's typically more so when it's going to happen. When she leaves the relationship, the guy goes after her. and finds her and kills her, as opposed to when she's staying in that relationship. And these women in these situations, they get an indication of that at some point along the way. Like maybe that first time they tried to leave, that the abuse got worse, the violence got worse. So that's when they make that strategic decision to stay in the relationship until they can figure out some other way to get out in a safe way. So I know it's hard to understand, but we need to think, like I said, think outside of the typical stuff and what we see on the surface.
One more. You said one more question? Okay. Yeah.
That's my experience, and obviously not in every situation, but where I did see where they would struggle through it, and then there was that for the black women who were in a relationship where the father of the children was living with them, right? So there was that whole other piece about, oh, I don't want to be yet another single black mother, right? And so as long as he's not harming them, and as long as he's being a so-called good father, even though you talk to children, they realize all that's what's going on, even though they try to keep it separate, right? It's kind of hard to, kids know, right? So that's my experience too, is that when it started to affect the children in some way, or the abuser was directly harming the children, that was more of a, as you said, galvanizing. Yeah, that was more of a motivation for them to try to really figure out a way out of that situation. Yeah, and get a little more strategic in how to maneuver themselves out of that situation. Definitely. Yeah.
Okay. Thank you.
Thank you.